Hi, everyone, and welcome to our 12th webinar. Today, we're going to start off a bit of a series. Our topic today is on proactive strategies, or otherwise known as antecedent strategies. But after this, I'd like to introduce something called reactive strategies or consequence-based strategies as well. In one of my previous webinars called Think Like a BCBA, I've gone over some of this information very briefly through hypothetical scenarios, but through these series, I'm hoping to discuss everything a little bit more elaboratively. So back to today's focus, we'll be discussing the various proactive strategies to help your child succeed. I'll be going over each strategy in detail, and we'll also discuss some considerations and some examples for each one. As always, all of our webinars are designed specifically for parents and caregivers of children and teens with neurodevelopmental disabilities. And I know a lot of our parents wear multiple hats throughout the day, from being a strong advocate for our children, also a teacher, a nurturer, and even a friend. And through these webinars, I really hope to provide some simple and practical strategies that you can use during your typical daily routine. To briefly introduce myself, my name is Stephanie Lee, and I'm a board certified behavior analyst or BCBA. I've been in the field since 2016, and I've worked primarily with children and teens with autism, ADHD, and other learning disabilities. So the strategies that I'll be sharing today, they come directly from my experience from working with families and students in both home and school settings. So let's get started. On today's agenda, we'll be going over the 4 functions of behaviors, a variety of proactive strategies, and some additional tools and resources that I'm excited to share with you. So let's start by discussing the functions of behaviors. It's important to know the function or the why or purpose of the behavior. We want to know what's motivating them to engage in those tantrums or aggression or yelling so that we can support them in the most effective ways. So functions of behaviors, here are those 4. First, we have escape in the red box. This is when a behavior occurs to escape or avoid a task or activity. This could be a task, an aversive or non-preferred situation, or even some kind of sensory input that just feels overwhelming for them. So for example, here we have a child who might be throwing a tantrum when asked to clean their room because she's trying to avoid the task. And second, we have attention. And I love this picture here. This is when a behavior occurs to gain the attention of others. A child might be shouting or engaging in some disruptive actions because they want someone to notice them. They want attention. Even if the attention is negative, such as a verbal reprimand like stop that or a frown, they will still thrive on the attention. So for example, in this picture, we have a mom who might be trying to work. Maybe she's working remotely. She's probably on a work call. And the child here is pulling on the earphones to get the attention. And you can tell from her face expression, she's frowning. She might have given him a verbal reprimand, but the boy is getting a kick out of it. He's obviously smiling. He thinks it's funny. Third, we have tangibles. This is when a behavior occurs to gain access to activities or items or maybe even a specific person. A child might cry or grab or flop on the floor at a toy store because maybe he or she they want a new toy. Fourth, we have sensory or automatic. Some behaviors happen simply because they feel good or meet an internal need for some kind of sensory stimulation. So some examples of this can be hand flapping, spinning, pacing back and forth, and even nail biting, hair twirling, or lip picking. So let's move on to proactive strategies. Proactive strategies are known as antecedent strategies. These are strategies that we can implement before a challenging behavior occurs to reduce the likelihood of the challenging behavior from occurring or even escalating further. So these are strategies to modify or control the environment to kind of set the stage up for success. So in other words, These are strategies that are put in place proactively even before a behavior happens. You might be wondering, okay, so what do I do after a behavior occurs? Let's keep that worry aside for now and just focus on these proactive strategies because one, these should help reduce the behaviors if we're really consistent about these strategies. And two, we'll discuss the reactive strategies, the strategies that we implement after a behavior occurs within the next few webinars. So first, let's start off with environmental arrangements. This is a powerful strategy to shape the physical environment itself. We can set the stage to support positive behavior and to reduce challenges before they even happen. So we're modifying the physical environment or setting. These are just a few examples of environmental arrangements. We can create a workstation to optimize focus and minimize distractions. This could be like a small desk or a table with minimal distraction where your child can focus on schoolwork or structured tabletop activities. We can also lock up hazardous items or keep them out of reach. Any cleaning supplies, medications, or shop objects, I definitely keep these high or with a childproof lock. We can also put these childproof locks on doors or windows. I used to have a family living on the seventh or eighth floor of an apartment, and the client would constantly try to elope to the balcony. Of course, it's totally fine for him to watch cars or just relax out there when there's an adult supervising, but when we're not available to do that, we want to lock those doors with childproof locks. We can also create a calm corner. This is a cozy and quiet area in the house where your child can go self regulate when they feel overwhelmed, or even stock up some calming items like pillows, sensory tools. If weighted blankets work for you, then go ahead and throw them in there too, or maybe even some coloring activities. So this kind of relates with our last point here, making sensory or fidget tools easily accessible, whether it's noise canceling headphones, stress balls, chewies. Let's keep them clean and available. So some considerations for these environmental arrangements, we want to always prioritize safety. So we can reduce dangerous situations by locking away hazardous items, maybe securing the furnitures or mounting them on the wall, and even planning for elopement risks. We want to create a safe space for dysregulation or sensory considerations as well. I'd also keep the area clean and distinguishable. We want them to understand the difference between work area versus play area. So moving on to priming or front loading. Priming is actually a very technical term in ABA, but I'm going to introduce it here in a slightly easier way to understand. So what is it? Priming or front loading can be a strategy to prepare the individual for upcoming events, tasks, or changes. So in a nutshell, this could include highlighting what's going to happen, walking through steps or scenarios ahead of time, or giving reminders when our children or teens know what to expect. It can reduce the chance of any surprise or maybe even confusion, and less resistance too. So some examples are the following. Marking a doctor's appointment on a calendar. You can hang a family calendar somewhere visible in the house and mark any significant events. Walking through each of the steps before baking or cooking. So for example, before baking cookies or preparing a meal together, discuss each of the steps in detail, like getting the ingredients that are involved or measuring, mixing, cutting, and so forth, so that your child knows exactly what to expect, when to expect. Showing a video of a typical visit to the dentist before the appointment. This is also a really good idea. Even for a trip to getting a haircut can be shown in a video ahead of time just to have your child familiarize themselves with the environment and the procedures. Role playing or rehearsing social scenarios are also great. We can practice what to say or any social gestures like waving when meeting new people or even ordering food at the restaurant. Reminding how much time is left before a transition. Transitions are tough, and if your child struggles with this, we can give them a countdown like in 5 minutes, we'll clean up, get ready for dinner, use a timer if you have to. And lastly, making an agenda or checklist for the day. So, creating a visual schedule or a checklist for the day are great ways to provide some sort of structure and predictability as well. In terms of considerations, we want to be very clear and concise. I'd also use very simple and familiar language so that I know for sure that my child understands what I'm saying. It's also important to set clear and appropriate expectations. Once that initial instruction or directions are established, we want to stick with it as closely as possible. We try to stray away from modifying it in the middle. We want to set the expectations clear. For example, before going to Target, we can set the expectation we're only buying groceries today. You can help me pick out apples, but we're not going to buy any toys. We want to set the expectations clearly. Lastly, we can accompany with visuals if possible. Personally, I love visuals, so any calendars, checklists, pictures, these can all aid your child or teen to literally picture the idea in their head. And visual supports itself is actually a proactive strategy that I'll discuss in a few slides. Premack principle. You may not have heard this term before, but I'm pretty sure you definitely use the strategies already. So, this is when we're allowing the opportunity to engage in a high probability behavior before a low probability behavior. So, in everyday terms, it's a first and then approach. So, for example, first work, then play. First finish your math homework, then you can watch TV. First wash your hands, then you can go grab dessert. First clean up your toys, then we can go to the park. First eat your veggies, then you can have dessert. So, in short, by connecting a less preferred task with something your child enjoys or is highly likely to engage in, you use these natural motivation to encourage any cooperation or engagement. So, some considerations for these are almost similar to our previous strategy. Be clear and concise, use familiar words and phrases, set clear and appropriate expectations, and again, use with any visuals if possible. Choice making. Choice making is pretty straightforward. I also think it's pretty good. It's really good practice in general. So, choice making allows opportunities for shared control and independence. We're offering limited but manageable options to a child, allowing them to have a say in their activities or routines. It's such a simple yet effective way to increase cooperation, reduce power struggles, and teach self advocacy. So here are some practical examples that you can use in everyday interactions. In terms of clothing choices, do you want to wear a green sweater or red sweater today? Hygiene preferences, which toothpaste do you want to use, mint or bubble gum? Footwear options, would you like to wear sandals or sneakers? Snack selections, do you want a banana or an apple? Reading time, should I read to you or would you like to read for me? Break options, do you need a 5-minute break or a 10-minute break? Or even the activities during a break. Do you want to color in your room during your break? Or do you want to go outside and play during your break? And lastly, rewards. Do you want to earn a sticker or a snap? There are so many different ways to incorporate choice making. But in terms of considerations, you know your child best. So if you think giving an array of two options might be too overwhelming, more than two options, sorry, might be too overwhelming, limit the array. Maybe start with just two and gradually increase as necessary. Also, use visuals too. You can use pictures or maybe even the actual items in front of you. If your child refuses to make a choice, we can either offer an alternative option, but if there are no other options that are available at that time, we can simply just make a choice for them and move on. We also want to make choice making a regular part of your interaction. So embed this practice into your daily routine so it becomes natural and expected. And when they do make a choice, praise them. Acknowledge their decision making efforts, like great choice or that's a great idea. And lastly, we want to follow through with the choice selected. We want them to take ownership and responsibility of their decisions. And visual supports. So visual supports are any visual cues, tools, or materials that aid in communication and learning and behavior management. These support supports making expectations and routines very clear. They also provide structure to children who benefit from just a little bit more guidance. Some examples might include a schedule of activities. I do have some examples on the top right hand corner. We can map out the day or maybe even the week by showing them the sequence of tasks or events to help them anticipate what to expect. Calendars, even we use these as visual supports. These provide a long term view of time and activities. Communication icons and cards. We can use picture icons to have them express their needs, like I want water. Token boards, I discussed this very thoroughly in my previous webinar, so if you're interested, please check it out. Token boards are great to have them track and monitor their own progress. Checklists and to-do lists, this kind of aligns with the schedule of activities, but these can be like a step-by-step visual for completing tasks or routines independently. Menu of preferred choices. We can be creative with this, but we can lay out the different pictures or icons that represent what they can earn as a reward or what's available too. Task analyses, we have a super tiny example on the top right hand corner. Whatever the task is, such as hand washing or brushing teeth, like in this picture, we can break down that task into smaller steps and we can create a visual. Think of it like a IKEA instruction manual. Those are like a visual of the task analysis to build a bookshelf or a table. Lastly, behavior expectations or rules. We can have a poster or maybe even a small sign that reminds them of what is expected. We can have like an icon of keeping hands to yourself, an icon to listen to others, and so forth. Just a visual reminder. Some considerations for visual supports, we want to make sure that the visuals match the child's developmental level and understanding. So, for example, with a 4-year-old student, I'd make a step by step checklist with lots of illustrations or maybe even simple, just 1 to 2 word phrases. However, with a 14-year-old student, I wouldn't make it that easy and simple. I probably reduce the illustrations and include a little bit more words and phrases. Portability is a big one. We should be mindful of how portable, or our next point, accessible these are. Potential distractions, we don't want to overwhelm them with too many details. We want to get straight to the point and be clear. If we're using visual supports, we want to make sure that they're not distracting them from the task itself as well. And of course, we want to combine any of our proactive strategies with each other just to boost up the effectiveness too. Manipulating motivation. This is our last strategy for today for proactive strategies. We want to create conditions that encourage desired behavior by making certain rewards or reinforcers more appealing. We want to optimize the value. So, establishing a reward or incentive for the on task or replacement behavior. So, some examples are limiting access to gummy bears to use as a reward. If we're set on using gummy bears as a reward for homework completion, we shouldn't be handing out gummy bears as a snack throughout the day. We want to keep it special. Limiting these unnecessary snacks prior to mealtime to increase eating is also really smart. If we have a child who has difficulty eating or completing meals, we obviously don't want to hand out unnecessary snacks before the meals. Having a movement break before a tabletop activity. This is for our students or kiddos who get super excited to get up and move around all the time. We can schedule a brief, short movement break before expecting focus on a tabletop activity. Placing preferred items or snacks out of reach but visible to increase motivation. We can keep favorite snacks or toys kind of where they can see, like a cookie if they're earning that as a reward, somewhere where they can easily see while they're engaging in the task, but not so that they can reach it and grab it before they complete the task. As for considerations, we want to assess the individual's preference. What does she like? What motivates her? We also want to manipulate the motivation through deprivation. We can do this by temporarily limiting access to certain rewards or activities to increase their value. Also, remind the student of the reward and incentive. For example, telling them, remember, after you finish cleaning your room, we're going to go outside. Additional tools and resources. If you're left hungry for more strategies or tips, I'd like to introduce some additional tools and resources that you can check out. So we have 11 other webinars other than this one that you can provide more tools and strategies as well. And you can check out our programs through VillageED. Not only that, we have some exclusive benefits like expert guidance with IEPs, comprehensive IEP checklists, a private community, resource library, on-demand support from specialists like speech pathologists, OTs, psychologists, and BCBAs like myself. Going back to these webinars, you can see all of our previous recordings on villageed.com. So that's VillageED.org. You'll see a screen like this to check out. Please see all of our other topics and any information about our program. I also wanted to introduce our resource library. So in our resource library, we kind of categorized it into three different sections. So the parent resources, these are just any informative tools that give you some additional details. Behavior management and skill acquisition procedures is second section. It's kind of like a step-by-step teaching procedure where you can kind of act like the teacher and teach a variety of different skills. So it could be teaching toileting, teaching a living skill, a daily living skill, or an adaptive routine. Maybe teaching a communication skill like teaching actions or teaching how to request with 2 to 3 word phrases. Lastly, we also have printable activities. These are super simple resources that you can just download and print, hand it over to your child. These kind of touch base up on all different domains like communication skills, social skills, social emotional support as well. So speaking of these resources, I have some that are relevant to today's topic. We have one particularly on antecedent strategies. This could just serve as a reminder or a tool just to keep it handy. We have one on transitions, on how you can make transitions a little bit more smooth. We have one on the power of rewards to give you a little bit more idea of that, to establish rewards and motivation. And I also have different pamphlets for each of the strategies that I've discussed today. So thank you so much for joining today's webinar on proactive strategies. I hope you found the information helpful and that you feel more confident in using these strategies to support your child's behavior and learning. I really do want to encourage you to keep using these proactive strategies and to be patient with the process. The goal is not perfection, but progress, and every step, no matter how small, helps your child thrive. So thank you again for your time today. If you have any other further questions, please don't hesitate to reach out. Thank you, and I look forward to connecting again soon.